if there is falling against a sharp or an angled edge, if the heavy blow on the chest, or if there's a fall from a height. So these are the causative reasons when you can have a fractured chest. The pain is worse with breathing, and there is a possibility that bright red blood comes out in the sputum. Okay, वो जो थूक आता है ना बाहर, उसमें थोड़ा blood हो सकता है. Plus, if it is an open wound, that is, there is a connection from outside to inside, then you will have to immediately do a proper airtight sealing dressing, because there is a difference in the pressure inside and outside. So that has to be taken care of. One second, I'll just get your Great Eastern manual. This half sitting position that they're saying, there is a picture over there. Give me a second. It is ideally known as the semi-Fowler's position. This book, I guess, when you come back here, they will give you. But this is what it looks like. See, this is the face of the book. Can you see it says the Great Eastern STCW manual? It's quite a thick book and lots of different sections. The EFA section is in the end. One second. I just want to show you that position. Yes. This position. Can you see this half sitting position?
Yes.
This is the Fowler's position, where there is support behind the neck, there is support in the back, and there is support in between the legs. The legs are folded like a V, and there is support there. This is the ideal position for a fractured chest patient. Understood? I will deal with these positions after I finish fracture. I'll just put a marker there and keep it. Okay. So that is something which you need to remember. Now that you've seen that picture, आपको समझेगा fracture chest suspected है, उसको ऐसे half support के साथ बिठा दो. Done. Okay. It's called the semi-Fowler's position. This itself can be a MCQ question. What is the name of the position for a fractured chest or any kind of chest injuries? That is the kind of position that you can offer. Okay. And of course, you will maintain a TPR chart, closely monitor the patient in case there is something more which you are missing. If I remove the skin from the front of the chest, this is what it will look like. This is the favorite and the most happening bone. What is the name of this bone? What is the name of this bone?
Sternum.
Sternum. Very good. Who said that? Who's that?
Roll number 19. GM.
19 GM. Tell me your name.
I'm Nilanjan Jana.
Acha, Mr. Kolkata. Okay, good. So over here, can you see? At the level of the nipples means it is at the fourth intercostal space. And a drawn from the midline will be ye jo semicircular canal hai, which you can put your hand in the neck and feel also. So draw a line here. And at this intersection is what is happening over here? Anybody? What is happening over here? What are you doing over here? You are giving chest compressions over here. So the heart, if you see, is located something like a fist right here. And the base of the heart will come just near the nipple area. The nipple is somewhere here. So here is the base of the heart. That's the location of that. So when you are giving chest compressions, you are empowering a failing heart. This picture will make a lot of things very clear. This is the clavicle and these are the ribs. Inside the ribs, you can see the two spongy areas, which are called the lungs. And in this particular picture, the sixth bone is fractured. Now, what I told you is, you are trying to give your chest compression over here. It is very easy to put pressure over here. So these joints can break and you can end up fracturing the ribs. As I told you, even if you fracture a rib or two, it is still pardoned if it is at the cost of a successful CPR. So go ahead, break ribs, but save the person. The second problem is, can you see this small triangular bone where my cursor is? Yes, boys? ये दिख रहा है जहाँ पे कर्सर है? मेरा कर्सर दिख रहा है क्या?
Yes,
हाँ,
ma'am.
this is called the xiphoid process. XIPHOID. Okay. If this get fractures, यहाँ से यहाँ आना भी कोई बहुत difficult नहीं है. You all have big hands, you know, giving an over enthusiastic CPR, you can end up fracturing this also. And that will cause internal bleeding in the liver. If somebody can tell me what are the 2 golden rules that I told you, if you are suspecting internal bleeding, क्या 2 changes होते हैं जिससे आपको पता चलता है कि internal bleeding हो रही है? Tell me.
High pulse rate and a low blood.
High pulse rate and a low blood pressure. Very correct. Just add another word to it in front. It is called progressively rising pulse rate and a drop in the blood pressure. Understood?
Yes, ma'am.
Who was the person who answered this time?
Elbow.
Acha, Eldo Thomas. Okay, good. I am quietly noting this down and giving you all additional points. Okay. So it helps to be nice and alert in class. Okay. So is this picture kind of clear to you now? Yes or no?
Yes, ma'am.
Okay. Fracture pelvis. Now, what is the pelvis? If I will just 1 second. This is the human skeletal, and it is this area which we are talking about, right? This is the pelvic girdle or the pelvis. It is formed of an assembly of the right and the left hip bone on either side, and behind you have the sacrum. There are 5 sacral nerves. Remember when we were doing the division in CNS, we were talking about, and the tip of the sacrum is called coccyx. So our previous ancestors, when they had tail, they had their tails from the coccyx. So this is the pelvic girdle or the pelvis that I am talking about. Immediately behind this joint over here, what is located? Where I have my cursor? क्या है यहाँ पे?
Urinary bladder.
Very good, urinary bladder. And just behind the urinary bladder in women we have the uterus. So this is a lot of happening places. Here I will just pause 1 second to revise the excretory system also, because it is in close correlation with the pelvic fracture. Where are our kidneys located? Here and here, more accessible from behind. Wherever the ribs are finishing, यहाँ पे 2 kidneys है, बराबर है? Okay. And urinary bladder you told me is over here. So the connection between the kidneys and the urinary bladder, as I am tracing the path, is called the ureter. They are thin tubes, and the work of this tube is what? To transfer whatever urine is getting made from the kidney, transfer from the tubes and collect in the urinary bladder. Correct? And then the urinary bladder, depending on whatever its capacity is, will throw it out via the urethra. This is the excretory system in relation to this pelvis. Now, what I am talking is, if 1, 2, 3, any of these 3 bones are fractured, then what? क्या होगा? कैसे पता चलेगा? Any answers? Okay. No point waiting. I will only give the answer. If there is a below the belt injury, where does the belt come? Somewhere around here, the waist area. So first,
Yes.
a fracture pelvis is if there is a below the belt injury. Second is, because of all this problem, the color of urine that comes out is blood stain. If you collect the urine of such a patient, that is, if you put in a catheter and collect the urine of such a patient and then look at it in bright light, you can see blood stains, or if you give it for a urine microscopy, there will be some amount of blood present. RBC cells होंगे. Point number 2 ये है. The first point is below the belt injury. Second point is presence of blood in the urine. And the third point is there is a test which is known as ring compression test. How does that name came? This is the ring, and they will compress this ring, and if there is a sharp pain, then the patient is fracture pelvis positive. कैसे करेंगे? Over here and over here, come over the casualty and place your hands over here and pull the thighs downwards and rotate it inwards. Pull it downwards and rotate it inwards. it is a very painful procedure. Do it only once. Does not mean if you have a fracture pelvis, chalo हाथ साफ करो, आज सबको check करते हैं कैसे आता है ring compression test positive. No, only one person will do it. If on doing this test, that is pulling the thighs downwards and rotating it inwards, the patient experiences a sharp pain, then it proves our diagnosis that this patient has a fracture pelvis. See, for me on shore, it was very simple. Had the patient come, bina kuch soche samjhe, I would have said, go and X-ray. If there is something, I would have thought of it further. But you cannot do that on your ships because X-ray machine is not there. So it is only on the basis of these symptoms whereby what is happening, all this is there. First is there is below the belt injury. Second is color of urine is blood stain. And the third point is ring compression test is positive. That you will conclude that there is a fracture pelvis and you will have to accordingly manage. Now the other problem is out of the excretory system, there are 4 parts: kidneys, ureter, urinary bladder and urethra. Which do you think, which of the 4 is likely to get injured maximum?
Mostly urethra.
Urethra,
Kidney.
kidney. अभी 2 और बचे हैं, एक वो भी बोल दो. Bladder. And now what is left? The right answer is left. Nobody gave me the right answer. The right answer is ureter. वो जो कनेक्टिंग ट्यूब्स थी ना 2 जो किडनी से यूरिनरी ब्लैडर तक कनेक्ट करती हैं,
Yes, ma'am.
those tubes are most vulnerable to injury. They are very thin, they are very delicate, and any disruption in the pelvic bones will immediately cut off those tubes. There can also be different levels of injury, and mostly it is a surgical repair for them. Because then what happened, whatever urine the kidney is making, it will all spill into the pelvis directly. क्योंकि urinary bladder तक तो पहुंच ही नहीं पाएगा, वो रास्ता टूट गया है ना? So this is a very, very big problem. The ureter gets injured and it can lead to pelvic peritonitis and a lot of problem. Okay, so a fracture pelvis means because of the pressure, the ureters are injured. So we will have to take care of that also. And then that is why fracture spine, fracture pelvis, immediate referral, because there are lots of more paraphernalias, there are lots of more complications, and definitely they cannot be managed at the ship level. Understood? Now, what is this fracture from hip to knee? What will you do in this case? In this case, you can do something like a direct packing. You know, put some cotton padding in between, put some Amazon के डब्बों से वो ऐसा ही सी बना के लेग को encase कर दो, or different ties, something like this. Make one cravat is what they call it, and specifically encase the fractured leg and give it immobilization and give it some splinting. So what are the 2 main words that we have learned today morning? Immobilization and splinting. Okay. Whenever you think of fracture, these are the 2 words that should immediately strike you.
Ma'am.
Follow.
Then you said if any person had a spinal fracture, then we should not move him, right?
Yes.
But ma'am, if the person is any at open area where there is more risk of accident, then we have to move them in any room. Then what we should do?
I will tell you. See, first of all, in that case, you will have to call the medical team. If they are not coming in the next 4-5 hours, okay, then what will you do is you have to have a stretcher with a stiff back. Okay. Plus, there must be 3 or 4 people who will mobilize a casualty, but it has to be in strict coordination. If you are lifting, ideally you should not lift. You have to roll the casualty and place him on the stretcher. But if you are lifting, it should not be कि head उठा दिया और पैर नीचे रह गए, तब आपका spinal cord injury और worse हो जाएगा. So it has to be like a team. At the count of 3, 2, 1, all should simultaneously pick up the body and place it on the stretcher. That coordination has to be there. Since it is a little difficult to do it, that is why they are saying if it is just a matter of 2 hours, then you give him some blankets there, create a home-like atmosphere in the deck and let him be there. But let the medical team come and evacuate. Does that answer your question?
Yes, ma'am.
Okay. This is a rare picture again that I have got where a umbrella is being used to splint. Poor man, he had nothing else to support. So this is his creative idea. Okay, if you can appreciate, this is the ankle joint and there are multiple fractures over here. Tibia, fibula, talus, the medial malleolus. I had sent you this picture, right? Above and below we were checking for the tibial artery. So multiple fractures over here and this is how they are managing. Okay. Not all injuries that happen can be a fracture. Sometimes it can be of a minor extent also and it will be a dislocation. The presenting symptom is the same. You will have pain, you will have swelling, you will have loss of sensation. All these are there, but it is to a much lesser extent. Itna kharab nahi hai. And the other thing is, as a pneumonia goes for them, rest, ice compression, elevation, and referral. Matlab you must give rest to these fracture areas. You must give ice compression. That is, try to reduce the swelling, keep it elevated. As I told you, place something such that the legs are raised 30 centimeters off the ground. And in spite of doing all this, if 24 to 48 hours have gone and still your casualty has not recovered, तो इसका क्या मतलब समझना चाहिए? Anybody, if anybody gives me this answer, full marks to that boy. क्या समझना चाहिए? Dislocation है या कुछ ज़्यादा है? और ज़्यादा है तो क्या है? After 48 hours of giving conservative management to a dislocation patient, that is rest, ice compression and elevation, still if there is no change, then what is your doubt?
A fracture, ma'am.
Yes, this is the answer I was looking for. That means then there is a fracture that you are not thinking about. You have overlooked it. So you must be fracture minded. And then what are the two golden words that you will add in the management of a fracture?
Immobilization and splinting.
Very good. Immobilization and splinting. Good. Looks like the concept has gone across to you and you all have understood well. Which are the two boys who just gave me those two answers? One who said fracture and the other who said immobilization?
Varun.
Varun. Okay. And Varun Panwar. Okay. How about the other one? Both the answers were from Varun?
No, ma'am, by Aldo.
Acha. Varun Aldo. Good. I am just making note. Varun Aldo and beach mein Jana had answers. And who else had answered just now? Aldo twice. Okay, one more. Rishabh had answered. Okay, tell me if I missed somebody. Okay, is this clear to you? Dislocation?
Yes, ma'am.
Right. Head injuries. Okay, I'll come back to this section. Let me just finish. There is the. Do you want a break now, or should I continue and then leave you a little early?
Continue, ma'am.
Okay, fine.
Ma'am, we have a next lecture at 3 now, I guess.
3 to 7, and we finish today at 7.
Yes, ma'am.
Yes.
Ma'am, let's quit for now.
Quit for now. How long?
Yes, ma'am.
Tell me.
Let's wind up for this lecture, ma'am.
We can't do that. There is a whole hour left. It's only 9:08. We can't take that much of a liberty. If you want a few minutes, it's fine, but I can't wind up the whole thing. Tell me what's your stick. Continue, so that
Continue.
I'll leave you by
Yes, ma'am.
around 9
Continue, ma'am.
or so. Okay.
Yes.
Do we have a unanimity on that? Vansh, break चाहिए?
नहीं मैम अभी तो सुबह सुबह कंटिन्यू.
Thank you. क्योंकि वो second half थोड़ा, और actually क्या होता है, once I finish this fracture, a lot of what I have to say is kind of done. अभी क्या थोड़े बहुत वीडियो है इधर उधर, ज्यादा कुछ नहीं, मतलब जो important portions है काफी कुछ कवर हो चुका है. Okay, playing this video, which is the official STCW video about fractures. Yeah.
In part 1, we looked at the importance of maintaining the oxygen to the brain using the ABC approach. We also considered the treatment of shock and of burns. In part 2, we shall look at fractures, other medical conditions such as diabetes and asthma, and at moving casualties. This video is modular, and we suggest that you look at one section at a time and then consult the supporting booklet, which expands on the points made in the video. Effective use of this training material will help you to deliver basic first aid to casualties on board. As a trained first aider, one of the most common injuries you'll have to deal with is one that happens like this. The majority of bone and muscle injuries are not life-threatening, but multiple fractures and spinal injuries can be. The most common type of bone injury is a closed fracture. In this case, it's the lower leg. It's a relatively straightforward fracture, except that there may be more than one broken bone. The lower leg contains two bones, the tibia and the fibula. If only one is broken, the other may act as a natural splint. If both are broken, it's likely that the leg will be distorted. Before starting any first aid, you must first remember to check for dangers to yourself and the casualty. In this case, as the leg is clearly distorted, it will need traction. This means realigning the broken bone so that it can reunite. While one person steadies the leg well above the break, the other pulls gently on the foot until the leg is straight again. This brings the ends of the broken bones back into place. Otherwise, the leg will either remain deformed or will have to be broken and reset at a later date. The next step is to apply a splint. Many ships carry inflatable splints. These are easy to put on and allow you to see the state of the injury. It should be long enough to extend beyond the joints at the end of the fractured bone. Every half hour, the pressure should be reduced for 5 minutes and then restored.
Right. Make sure you cool.
You will also need to check the circulation and color every 10 minutes. Press the patient's toe for 5 seconds, and after releasing, the color should return in 2 seconds if normal. Also, test the patient's response to stimulus. If the limb is to stay splinted for longer periods, you need a conventional splint made of well-padded lengths of timber or strong cardboard. One goes under the leg, the other two go on either side. They must extend from the middle of the thigh to beyond the heel. Make sure there is plenty of padding. Then, using sheeting or bandages, tie the splints firmly together. Make sure you don't tie over the breakage points, or you'll hurt the casualty. Look for signs of shock. They are taught in Part 1. If the victim has broken both upper legs, you should automatically suspect a pelvic fracture as well. This means you must look for signs of shock. Then, apply well-padded splints extending from ankles to the victim's armpits. Make sure there is plenty of padding between their ankles, knees, and thighs. To keep their feet together, tie a bandage in a figure of 8 around their feet and ankles. The same basic techniques apply to broken arm bones. The key signs are swelling, deformity, and loss of function. After treating the casualty for pain, apply traction if necessary to straighten the arm. Be firm. Large triangular bandage or clean piece of cloth and spread it between the bent arm and the body. Put one end up around the back of the neck to the injured side. Bring the lower end of the bandage up
That's how
over
they're
the forearm
teaching how to tie the
meet the
triangular
other
bandage.
end at the shoulder. Tie a reef knot at the hollow over the collarbone on the injured side and tuck the ends underneath. Bring the point in front of the elbow. Tuck any loose bandage underneath it, above the elbow, with a safety pin. If the elbow won't bend easily, you need to use long padded splints on the outer and inner surfaces of the arm, bound together as demonstrated with the leg splint. If the lower arm is broken, the same principles apply. Put the arm in traction if necessary, then fit splints to the top and bottom of the arm. They should extend from beyond the elbow to the middle of the fingers. When the splint is in place, fit a sling as shown earlier. The hand should be raised about 10 centimeters higher than the elbow. If it's a broken wrist, you should not attempt to manipulate or straighten it. Fit a padded splint extending from the middle of the lower arm to beyond the tips of the fingers. Place a firm ball of gauze under the casualty's fingers to hold the hand in a cupped position. In cases like these, seek radiomedical advice immediately, as further emergency treatment may be required to preserve the hand's function. A potentially much more dangerous...
Now they are going to show the ring compression test. Where they are holding the thighs and pulling it downwards is how the test has to be done. So you must ideally place the casualty on a flat surface and then do it.
Injury is a fractured pelvis, which is often present when both upper legs are fractured. It can cause internal bleeding into the pelvic cavity and the lower abdomen. To test for a pelvic fracture, press gently on the front of the hip bones, downwards and inwards. Do this test once only. There will be pain and possible movement if the pelvis is fractured. You need to take great care in moving the victim. If he has internal bleeding, he will start to go into shock. So watch for the signs and monitor how his condition changes. If he passes urine, collect it and test it for the presence of blood if the kit is available. When you have completed your initial assessment, get radiomedical help.
Open fractures now.
Open fractures present the additional problems of bleeding and exposed bone and tissue, with high risk of infection. The first priority is to control the bleeding and get help. Here, one of the bones in the lower leg has punctured the surrounding tissue and skin and is now exposed. First, you should ensure that you have the infection risk and the bleeding under control. Your next job will be to get the bone back again. With an open fracture, the bone may be contaminated by contact with the skin surface and the air. There will also be a flesh wound and bleeding to treat. Open fractures are distressing to see and deal with. As in any first aid situation, it's important that you remain calm and reassure the casualty, who will be anxious and in great pain. Treating an open fracture may involve the additional problems of blood loss and infection. If possible, get someone to support.
Again, all open fractures are not to be kept on the ship. They are candidates for evacuation. Remember that. So fracture skull, fracture spine, fracture pelvis, open fracture, all of them, emergency procedure is you will have to evacuate them.
Support the limb while you work on the wound. The casualty should not be moved unless he is in great danger. Make sure that the limb is supported in the way that causes the least pain. On the rare occasions that the bleeding is severe, use a sterile dressing or a clean pad and press down on either side of the exposed bone. Now, place padding over and around the dressing. With a protruding bone, build up the pads until you can bandage over them. Don't use anything fluffy for this, because it will stick to the wound and the bone. When you're satisfied that the bleeding is under control, immobilize the limb.
See, this is a different kind of a material they are using as splinting. These are plastics and they are kind of stiff ones which are moldable. They can change them into any shape. Okay, and that is this is also there on our ships.
When the limb is secure, get the victim to the medical room or their cabin.
We had an accident. I dressed the wound, but there's some bone coming out of it, so you have to.
So she's saying there was an accident. I have dressed the wound, but there is some bone coming out. And now we have a doctor who's kind of further managing things.
Check for signs of shock and other injuries. Then get radiomedical help. The shore-based doctor may well advise traction. If the victim is showing signs of shock, the doctor will advise you how to proceed. If you're on a passenger ship, the medical officer or doctor will know what to do. It's also essential to check the pulse regularly beyond the wound, away from the heart. The doctor would then instruct you how to deal with it. A dislocation presents similar problems to a fracture, and the treatment is basically the same. In this case, it's a dislocated shoulder caused by a heavy blow. It's extremely painful, especially if the victim tries to move the joint. A typical dislocation causes swelling and a misshapen appearance. It's best to keep the casualty in a sitting-up position. Place some loose padding about the size of a fist in his armpit to avoid skin-to-skin contact. Then, tie the arm to the body just as you would with a fracture. Unless the person knows he has a recurrent dislocation and can tell you what to do, you should not attempt to relocate it. Now get radiomedical advice. A dislocated finger is much simpler. If possible, you should have the injury x-rayed before attempting any reduction. But if this is days away, then start by bending the casualty's elbow to a right angle if this is possible. One person then pulls firmly on the finger, while the other pulls in the opposite direction on the elbow. Keep this up for at least a minute to get the ends of the bones apart. Then, Gently ease the joint back into its normal position. When you're satisfied that the joint is back in place, immobilize the finger by fixing it to a splint and strapping it to its neighbor. Leave it for 24 hours. After 24 hours, remove the strapping and ask the patient to exercise the finger carefully. At the next port, make sure the casualty gets it x-rayed and seeks any further medical advice. The most serious fractures you could face are those that involve the spine. Always suspect spinal injury when someone has fallen more than their own height. If the vertebrae and discs of the spinal column are damaged, the casualty could experience pain in the neck or in the back at the level of the injury. You can sometimes feel a swelling over the spine, and it can be painful when touched. Spinal cord damage is a much more serious problem because it is the high...
See here very closely, if you can see, this is the vertebrae and you have the spinal cord which is passing through it, and these are the nerves. Any injury over here in this area is the
way for messages between the brain and the rest of the body. If it is pinched by a displaced disc, you can expect some form of temporary nervous damage. But if it is severed, the result can be paralysis or even death.
Okay, just lie as still as you can then, all right?
When you have reason to suspect spinal injury, your first priority is to avoid any further movement of the spine and the neck. Hold the neck, keep him still, and don't try to shift him until you have plenty of help. Don't let go. Shout for help until someone comes.
It's been an accident, can somebody help me, please? Can you come and stabilise his head for me? I think he's hit too high. Okay. All right, well, I'm straight now. Okay, I'm going to have a look to see if it hurts anywhere. So can you tell me if it hurts? No? Look at me. And all right.
A quick test is to see if the victim has lost any sensation in his body. If he has, the spinal cord has almost certainly been damaged somewhere. If his neck is injured, it is possible that he will have breathing problems.
You can't feel all right, mate. Don't worry about it.
But even if there are no signs, you should still proceed on the assumption that his spine is injured. Any lack of sensation may mask other injuries, especially abdominal pain.
Okay, I'll just check your arm, all right? You squeezing hand for me? Okay, I'm just going to get the collars and the oxygen. I'll be back in a minute. Keep it as still as you can. Okay, what we need to do first is bring his head into line. I'll bring his head up so his nose and his chin in a straight line.
Now you need oxygen and a collar for the casualty's neck.
This is the main neck collar that we have on our ships. One portion comes from top, the other from behind, and it completely encases the neck.
The sooner you have these items, the better. Ensure the collar is the correct size, and when fitting it, be careful that you don't twist the casualty's neck. Keep it as still as possible.
So I'm just going to put this around the back. You feel me going around the back of your neck.
Be very careful when moving victims in this situation.
Can you see how they are rolling and placing, and it has to be all together in one shot.
You have to roll the casualty into the stretcher without moving their spine. Keep their neck supported at all times. The stretcher must have a stiff surface, not a canvas one. If the stretcher is not stiff as required, add a plank or wooden board. It requires careful coordination, with one person calling out the instructions. Make sure you have plenty of help. You can't do this on your own. Once you have brought the casualty to safety, check for shock. You must reassure them. Remember how frightened they will feel. Shine a light in their eyes. The pupils should contract. If they don't, The reflexes and nerve endings may have been damaged. Keep repeating the procedure to see whether there is any response. If not, radio for assistance. Return to the casualty and carry out their recommendations. The most common form of muscle injuries are strains and sprains, which are nearly always caused by falls. With sprains and strains, the injury will swell a little after the accident. This is caused by the tissue bleeding internally. It can be hard to tell if a fracture is present as well. With a fracture, it may hurt a little away from the site of injury if pressure is applied. If you're in any doubt, fit a splint. Otherwise, put the casualty in their bunk and raise the injured part. Your next step is to reduce the swelling with the application of a cold compress. The best method is an ice pack held firmly in place by a bandage. But a packet of frozen peas will do just as well. Put it on for 20 minutes. Repeat at least 3 times a day for 48 hours. Make sure there's no direct contact between skin and ice. The patient now needs to rest for 2 to 3 days or longer if the injury is severe. They must keep the injured part elevated, but they must also be encouraged to move the injured part as long as you're sure there is no fracture. It's better to have early movement than too much rest. Apart from accidents, you could have to deal with many other surprise situations with the potential for serious harm or even death. For example,
We'll stop this over here. In the meantime, if Jeet can just show us the PowerPoint of the DG shipping fracture videos, so we will be done with that section. Jeet, can you log on? Yeah.